I'm coming from Salesforce Research in San Francisco, where I head medical AI, and I maintain a position at Stanford as adjunct faculty in the School of Medicine. And a lot of my research really centers on the use of artificial intelligence in healthcare for the diagnosis of conditions and their treatment. Specifically, I work on computer vision, and one area that I actually did several years of research on is in applying computer vision to dermatology for the diagnosis and management of skin cancers. So one exciting area has been the continuation of research along the lines of diagnosing skin cancers directly from pictures and demonstrating that the performance of algorithms is actually consistently on par with physicians and dermatologists at identifying if a lesion is malignant or not and how to manage it. A really recent paper actually did a large-scale trial comparing algorithms to dermatologists and comparing a single algorithm to over 150 dermatologists at identifying skin cancer. It was amazing, and actually showed that consistently the algorithm outperformed the physicians. And then researchers have taken that a step further to try to identify, in a clinical setting, what are some of the challenges that we can expect to encounter if we were to deploy something like an app or a total body system with algorithms running for the diagnosis and management of skin cancers. And they've started to explore some of the challenges that will arise in biopsy settings and so forth. The key breakthrough in the last roughly 7 or 8 years now has been in the usage of a type of algorithm called a deep learning algorithm, which has been really effective at extracting insights from massive amounts of data. And occasionally those insights can come from several different types of data. You can imagine wearables data like your smartwatch. You can imagine image data taken with your smartphone. You can imagine data from your electronic health record that gives a computer a sense of who you are and who you have been medically speaking over the course of your life. And you can imagine such algorithms actually synthesizing insights across these data streams for highly personalized care and highly personalized skincare. One simple way is to have an algorithm diagnose your skin's needs. So you can imagine not only diagnosing a skin lesion as benign or malignant from a picture, that can already be done with incredibly high accuracy. But you can imagine systems such as a total body system, like a total body skin scanner that you stand in front of, it photographs your skin, maps out every last concerning lesion, and then makes recommendations to a dermatologist on how to treat those particular lesions that might be concerning based holistically on your entire skin. You can imagine in terms of skin care, systems such as taking a selfie with an app that would analyze your skin, analyze its conditions, predict your age, include demographic information and so on to give you very personalized skincare recommendations. Or you can even imagine systems that would let you track over time the effect of medications on chronic conditions like psoriasis or eczema, which can flare up and flare down and so forth, to analyze the effectiveness of different treatments on the individual. I think it's really exciting to see how artificial intelligence is going to make its way into skin treatment, both in the dermatology clinic, where we can imagine these systems getting deployed for skin cancer management, but perhaps also at the consumer level, and helping consumers understand their own skincare needs directly from self-analysis via apps. And I think Europe is a particularly exciting area to think about the use of AI in skincare and in skin health, given that the regulations in Europe are actually a little bit lighter than those back home. And so seeing the progress of algorithms that can help patients in Europe has been really enlightening and much faster than the United States.